Hi, everybody, and thank you for giving your time to an Aconia webinar. My name's Robert Sullivan, and I'm here to introduce to you Dr. Silverman, who is actually in New York. So I'm going to say good morning to him. I'm going to say good evening to you guys in the UK, and I'm here in Dubai, so it's good night to me. So Rob Silverman is a very accomplished chiropractor. He's a nutritionalist. He's also an international and national speaker. He's a best-selling author of one of Amazon's books, Inside Our Health. I think I'm getting all of this right. He's founder and CEO of Winchester Integrative Healthcare. And also he's been responsible and lead, I suppose, researcher on a lot of the studies that Aconia has done. He has a book just out or just about to come out called Superhighway to Health. He doesn't really need too much introduction. I think most of you know him quite well, have heard him speak before. The topic this evening is basically you can't control a virus, but you can control the host. So without further ado, I'm going to hand you over to Rob, and he's going to take you through this evening's education.
Thanks so much, Rob Sullivan. I greatly appreciate it. It's always a pleasure to share a platform with you. I'm excited to be here. I hope everybody's having a great evening where they are. And I would like to share some interesting things about the idea of that you can control the virus, but you can't control the host. It's true. Viruses we can't control, they're everywhere. They're a pathogen. However, the point is, by controlling the host, us, our patients, our friends, our family, we can hopefully build up their immune system to be able to deal with any kind of pathogenic onslaught in an appropriate fashion. So I'm going to share some key takeaways in the next 75 minutes on how to help your immune system yourself via nutrition, laser, and lifestyle. Jim Rome, he's a personal favorite of mine. I think he does a great job, but he's got a quote that I share with all my patients. Take care of your body. It's the only place you have to live. Now, it's true, whether you have 10 cents or $10 billion, if you don't have health, you have nothing. So for me, health is wealth. As long as we're healthy, we can always wake up the next day and make that day better than the day previous. So there's no reason to avoid it. It's very clear that there is a pandemic going on. There's a worldwide pandemic, but the real epidemic inside the pandemic is the issue. And that epidemic is that the bulk of our populations, and when I say ours, over here in North America and where you are in the UK, we're just not healthy populations. As we all know, that specific viruses attach to what we call the ACE2 receptor sites. Now, what we're seeing is patients who are heavier have worse, or obese, have worse outcomes with viral infections. And the reason is they have more ACE2 receptor sites. In addition to that, those who are obese or have too much body composition, with the fat cells being reservoirs for viruses and pathogens, fat cells are depositories for toxins. This leads us down a path where we want to have our patients in the most streamlined, sinewy type of body compositions possible. And one huge takeaway is obesity increases the duration of time of a viral shedding. It means it's going to last longer if you have a viral infection. And maybe one of the biggest ideas is the adipose tissues. I really want to piggyback on that idea that adipose fat cells are those reservoirs. So when most people say, well, I only have an extra 10 pounds. Well, yeah, it is like you're walking around with a vest of 10 pounds, but you're walking around with a reservoir, depository of extra space for your pathogens. So are many of the issues that we're talking about that we're seeing currently today, are they preventable lifestyle disease? I'm a big proponent of lifestyle. And what do I mean by that? Changing your diet, having a flexible type of diet, eating good whole foods, using intermittent fasting or time restrictive eating, getting some exercise, some stress relief, and the like. These are American numbers. So you know, America is #1 we're #1 in unhealthy populations. The UK is close. You guys are now #3 or 4, depending on which study we look at. Having said all that, the underlying chronic illness, 42% obese, 75% overweight, 6 out of 10 people have at least one chronic illness, 4 out of 10 have more than one chronic illness. Obesity increases the risk of death 3 times. All of these lead, or all these above lead to inflammation. My mantra, and one of the things I love to talk about the laser, is the ability to manage and modulate inflammation. So piggybacking on that concept of preventable lifestyle disease, that belly fat. Now, is it really just the belly fat, or is it the visceral fat, the fat that's inside, that fat that can infiltrate your organs in your viscera? That poses an issue. That's extraordinarily inflammatory to your brain, and specifically inflammatory to your body and your brain. Older people over 65 have tremendously decreased immune function. Where I live, approximately 12% of the population is metabolically healthy. So that means if you're a practitioner and you see 30 people in a day, 4 are metabolically healthy. And that's also going to include those who have an appropriate body composition. So what about pre-existing inflammation? Well, study came out that 94 to 97% of people who died from COVID, if I can use that as a marker, and hospitalization are pre-inflamed, people walking around with inflammation too elevated. So we know it's not the virus to let it resonate, it's the host. The viruses don't kill you. Viruses, or the body's response to the virus, puts you on that deleterious path. America's pre-inflamed. Our body's immune response to virus injures us. Once again, 75% of Americans are overweight, 42% of Americans are obese, 12% are metabolically healthy. But believe it or not, 20 to 40% of normal weight people are metabolically unhealthy. So once again, it's not just about your body composition. It is a component of consideration. It's also about how well your systems function. Our bodies are a coordination of systems. We spoke a little bit about the visceral fat previously. Immune system is suppressed. Immune system is suppressed through a multitude of things. Immune system is suppressed, obviously, if we have too much body fat. Immune system is suppressed, interestingly enough, if we've got a compromise of our gut health and our gut matrix. Our immune system is suppressed if we consume too many carbohydrates. If you consume 300 kilocalories of carbohydrates, you decrease your immune system by 50% for a 2-hour period. You shed your virus slower. And what previously is, that's what we're putting together, that you shed it slower. That's why you shed it longer. And quite frankly, immune systems respond slower to any kind of vaccine, any kind of medication, any kind of supplement if you're not healthy. So a strong, stout immune system will respond to any kind of other stimuli, whether it's a vaccine, nutritional support, laser food, etc. Now, decreased immune systems don't produce antibodies. So interestingly enough, you'll see many people who have been sick with a multitude of things don't produce enough antibodies, or they produce too many, the titer is too high. I can't tell you how many times patients have come in and we've examined blood labs, really analyzed them and seen Epstein-Barr, for argument's sake, through the roof. But here's a takeaway. Here's a little of the secret sauce. You can make changes in a matter of days, 2 weeks, if you change your lifestyle, take your supplements, and start implementing low-level laser therapy. So this is directly October 2020, some risk factors for COVID. 61 million people had medical records in the UK. I found that an interesting number because I looked up, it's about 67 million in the UK. Please correct me if I'm wrong when the question and answer is there. 30% of COVID deaths occurred with diabetes, 3 times higher with type 1, 2 times higher with type 2 than without diabetes. Diabetes is noted as an underlying condition in 4 out of 10 patients. There is a diabetes-obesity link. We call that diabesity. So one of the biggest issues you're going to see for immune compromise to any kind of virus is going to be body composition and inflammation from high blood sugar. Let's take a look at the effects of obesity on the inflammatory cytokine production and insulin resistance. So high levels of body fat or increased body composition, i.e. obesity, is going to lead you down a damaging path where you're actually going to release more inflammatory cytokines. Those inflammatory cytokines, which we're going to touch upon in a little bit, lead us into the idea of the proverbial cytokine storm and lead us to have an increased incidence of insulin resistance, all really damning to our overall health. Here it is. Here's our immune system. And I can tell you that I have learned more about the immune system in the last 10 months than I ever knew possible. The immune system provides 3 levels of defense against disease-causing organisms. Number 1, barriers to prevent injury. Our skin and our mucous membranes are our first barrier of our immune system. Stomach acid and digestive enzymes give you the ability to kill specific things that you've ingested. Beneficial bacteria that live in the colon, or if you will, our microbiota in our microbiome, that also can be quite beneficial, leading us down an immune-enhancing path. 80% of our immune cells are in our gut. It's where our macro and micronutrients are absorbed. So without question, our gut health is a critical element to our overall health and our immune health. Our innate immunity, everybody has one. It's a general defense. It's like Marines, if you will. They're search and destroy. They have white blood cells. They're called neutrophils and macrophages, which engulf and destroy foreign invaders and damaged cells. Whereas we have an acquired immunity, we acquire it as we age, but it's also adaptive. So it's acquired and adaptive. It's the second arm of our proverbial immune system. It's a specific defense. It's those white blood cells called T lymphocytes that come from the thymus. And please make note right now of the thymus, because I'm going to show you how to laser the thymus. They are what we call our recognized portion of our adaptive or acquired immunity. Whereas you have your B cells. Your B cells come from your bone marrow. They recognize that's where your antibodies come from. So humoral and cell-mediated branches of immune response. The humoral branch comprises of lymphocytes of the B cell lineage. Antibodies are the effector molecules produced by this response. The process begins with the interaction of B cells with antigens. Binding of the antigen promotes differentiation into antibody-secreting cells. The cell-mediated branch comprises lymphocytes of T cell lineage. Just remember the T cell lineage, as we spoke about before, comes from the thymus glands. Recognize and memorize. The innate and adaptive immune system. I really like this picture. It's older, but it's been redone. The immune system fights germs and foreign substances on the skin, in the tissues of the body, and in bodily fluids such as blood. The immune system, again, is made up of 2 parts, the innate, which is your general immune system, and the adaptive, your specialized immune system. These 2 systems work closely together and take on different tasks. A real takeaway in these systems is they need to be balanced. One of the biggest problems with a faltering, if you will, immune system would be an imbalance between the innate and the adaptive immune system. Here we go. The cytokine storm, this dangerous double-edged sword exploited by many different viruses. The bottom line with the coronavirus and any other virus there is very simple. Cytokines are released at the time of inflammation. When you're pre-inflamed, your inflammatory markers are elevated. Then you get hit with a pathogen, a virus, a bacterial infection, and then you become overwrought with cytokines. If I could metaphor for a second, think of a cup, an empty cup, and think of water as cytokines. If you're not pre-inflamed and you get hit with a virus or a bacterial infection and you pour some cytokines out, which are water, into your cup, it's probably in your cup and you can handle it. It's when you're heavy and you've been sick before, you already have pre-filled that cup. Now comes on this really heinous virus or bacterial infection, you pour some more water on and the water overflows in the cup all over the place. That means to imply, or I'm trying to vivify the idea of the cytokine storm. Viral and cellular membrane. Any virus must enter a human cell, replicate, and damage the cell. escaping to infect adjacent cells. For viruses, there are 3 enzymes that play a critical role in this sequence. Number 1 is the ACE2, number 2 is furin, and number 3 is 3C-Pro, which all lead to the stimulation of the NLRP3 inflammasome. The NLRP3 inflammasome poses an issue in that this is an extremely inflammatory pathway. That's end result is to stimulate NF-kB and release all these different types of cytokines, i.e. interleukins. So let's take a look at some immune support supplements. As everybody knows, I use a lot of nutrition in my office, and here's some things that I would recommend with all of you. So here are some of the supplements: vitamin C, zinc, mixed mushroom complex, vitamin D3 with K2 getting a lot of data behind it, getting a lot of play in the news, probiotics, NAC, liposomal glutathione, selenium, omega-3 fatty acids, elderberry, and vitamin A. Antiviral support: if you think that someone has a viral infection or you're concerned, here are some of the nutrients and supplements: quercetin, EGCG, melatonin, PEA, lipoic acid, pomegranate, omega-3 fatty acids. And if you want to blunt the release of the NLRP3 inflammasome, here's your litany of different nutrients that will help you. But let's share some insight on a few of them. Curcumin. Curcumin has been shown to reduce inflammation. It enhances the immune system, decreases viral growth. It can reduce symptomology. Quercetin is found in fruits and vegetables and is shown to decrease viruses, enhance immune system, and reduce symptomology. Zinc. Zinc is great if you have any loss of sense of smell or enzymatic reactions. A great choice, helping the immune system, reducing symptoms. NAC also promotes the production of glutathione, the master antioxidant, and that also helps the immune system and reduces symptomology. Melatonin, a hidden gem. Not only good for sleep, has shown to reduce inflammation. Elderberry is great previous to a viral infection. PEA is a naturally occurring anti-inflammatory agent that's been shown to improve outcomes. Green tea may be the secret sauce in that green tea can block docking sites of cells not to allow viruses and bacteria to pass the cell membrane. And here's an immune response. I am going to share, Julie before asked, and I'm going to share all my slides with you. So you've got a copy of this so you can review it. If you want to turn my volume off and just look at it, you can use this. This is an excellent, I took this from a periodical. It explains the inflammatory and innate immune response needing vitamin A, vitamin C, vitamin D, zinc, and omega-3 fatty acids, and all the things that they can do to help you. In the interest of time, I'll let you guys all go through those. Please make note that for me, the real takeaways are going to be the vitamin D and omega-3 fatty acids and the zinc. And the adaptive immune system, what it does. So they have a pleiotropic approach, these 1, 2, 3, 4, 5 specific nutrients and fats, and you can see the different effects that they all have. This would be a standard starting point for anybody to really imbue the body with a strong immune response. So having said that, I just want to piggyback on a little bit of vitamin D. Vitamin D, the model of interactions between genetics, gut integrity, microbiome, and vitamin D deficiencies. Genetic disposition can influence vitamin D activity, integrity of the gut barrier, and basal level of immune activation. Low vitamin D increases the permeability of gut barrier and heightens immune activity. Furthermore, for me, low vitamin D and the permeability of the gut alter microbial composition and the ability of the microbes to translocate across the intestinal epithelium, leading to interaction with host immune systems. Ultimately, the immune system activation can contribute to autoimmunity. Vitamin D is your standard starting point. I'm a big proponent of D3 mixed with K2, and as you all know, vitamin D does a great job with the inflammatory innate immune response and the adaptive immune responses. It does a great job in that modulation of macrophages, and also it has a multitude of benefits to the body, both for immune health and, believe it or not, for musculoskeletal health. I might as well take a moment now and just go over a couple of the omega-3s. because there's some differentiations in them that are noteworthy. Omega-3 is the structure of the cell membrane, inhibition of cytokine production, inhibits neutrophil migration, and really helps with the clearance of a lot of gunk, if you will. Great for an innate immune response. Specialized probe resolving mediators. They're better for the adaptive immune response. They actually help with Treg cells formation, B cell activation, and they can upregulate and allow for the resolution of inflammation. So for me, they're a critical element. And last, zinc. Of course, zinc is great with the membrane barrier integrity, antiviral effects, decreases oxidative stress, and also limits the excessive release of cytokines. It blunts and puts a stop almost on the release of multiple cytokines. Vitamin D supplement is a gut microbiota modifier. It significantly increased gut microbiota diversity. Diversity is the key. The biodiversity in your gut is the key to your immune health. And it also allows for the eliciting of beneficial effect by improving the health promoting probiotic taxa. So believe it or not, the first 25 minutes, we talked a lot about nutrition and some lifestyle. We're going to do a summation at the end. Now, let me get involved in the Aconia laser system. I started using the laser on myself. So for me, I have what they suffer from congenital torticollis. So originally, I used it in a musculoskeletal light. Then, with the burgeoning amount of data and research that were done, I elevated to use it to more of a functional medicine, functional movement light. I started to get people to move and work in a proprioceptive light, started to help people's guts with these lasers, then had brain work. I will share with you the vagus nerve. You guys are going to want to see that. And now in the last year, I've been using it to aid for me to help with patients' immune systems as far as I'm concerned. So on the left, real brief, we've got the accelerate. On the center portion, the violet wheel or the purple looking one, that one has both a red and a violet light. So let me take a step back. The accelerate has a red light, 635 nanometer light, FDA clearance over here in America, and without question is shown to be great for musculoskeletal healing and have a positive effect on the systems of the body. For me, the treat, if you will, my go-to is the EVRL. It has both a red and a violet light. The red light, 635 nanometer, again, musculoskeletal. The 405, the violet light, which I will demonstrate for you before we close today, has an antimicrobial, antibacterial, antifungal. The combination allows for the balance of the autonomic system between the sympathetic and the parasympathetic. For me, the utilization in my office of the EVRL has brought my clinical outcomes to new heights, and I've been able to help attenuate many of the people's conditions, both musculoskeletally and systemic. When you look at the last set of lasers, that is what we call the base station. And the base station is typically 3 different handheld lasers. The traditional base station is 2 accelerates with 1 EVRL. However, now I will tell you that most people will buy the 2 EVRLs and 1 accelerate. And last but not least, you will see it, the FX635, which has an FDA clearance for nociceptive musculoskeletal pain on all the joints. I'll have some videos with it, and if you'd like, please ask me to demo. I'll go in my treatment room, and I will be happy to demo it for everybody. So here we're going to have an immune boosting supporting protocol. If you look at the left, there are the frequencies I use with the different lasers. Hi everybody, it's that demo portion where I want to show you some immune boosting, immune supporting protocols with the lasers, really pointed at trying to decrease that possible cytokine storm. So the patient will come in, you'll start them in a supine position. You're going to go for 3 different protocols total, 2 in a supine and 1 in a prone position. You're going for the thymus gland. Thymus gland is a tremendous immune boosting gland. It shrinks as we age. Thymus gland is right behind the breastbone. So I use a red and a violet light for the thymus gland. Frequencies are already put in, and I'll go right to the thymus with the the red and the violet laser, the 635 and the 405 synergistic combination, and I'm not applying any pressure, and I can clearly, if I want, keep it right on the stand or get a little distance if that would be covered. So that would be the thymus gland protocol, great starting point. Now, I've seen a lot of different protocols for immune boosting, and I think that sometimes we overlook the fact that the vagus nerve's number one, believe it or not, its number one function, if you will, is to decrease peripheral inflammation, in addition to, of course, allowing the gut to brain to communicate. Having said that, I'm going to go to the acne setting. I use the acne setting for the vagus nerve, and I'm going to go for the medulla oblongata. I'm only going to do the right side. Down through the transverse colon. Wave back up. Medulla oblongata, brainstem, down through the transverse colon. Remember, it's an 80 to 90% afferent nerve. Senses what's going on in the gut, so you'd be fine if you would also incorporate it in a succeeding video. You'll see this, the gut protocol, and you're going to do both sides. I just started on the right side because the right side is got the ileocecal valve over here. So both sides. So you would do the vagus nerve for immune boosting, kind of been overlooked. And last but not least, if you would switch, have the patient go in a prone position. I'm going to keep it EVRL, I'm going to go to both a red and violet protocol. I'm going to go to a setting there, and I'm going to go for the spinal cord. And we forget about that. We are chiropractors, and we forgot about the central nervous system. So I'll do the spinal cord right here in a prone position, wave it. And if you have the opportunity, if you have a base station, here's the accelerate. Just turn the accelerate on. And you could just use the accelerate if you'd like for the spinal cord as a finishing touch. Go up through the brain to get part of the brain in the central nervous system. And I have one more little trick up my sleeve for you. If you happen to be interested or have the FX635, what a great thing to implement. Put it right over here, get it in her area, get it in her spinal cord area, and just let's go. And now she has that going along. And just as I finish, if you've got two things, if you happen to have a handheld and FX, there's a multitude of things you can do. The EVRL is going to get you everywhere you need to go. It's a great handheld. I'm showing you the accelerate. If you had a PL touch, so be it. FX635 is fabulous. Just remember that one of the biggest things that we could consider is keeping our patients' immune health strong in this era where now it's just cascaded, where everybody's talking about it. I can guarantee you, if we talk immune boosting, immune support, people are going to come and seek us out. So that was one of the video demos. We have 3 video demos. I will, without question, I'm going to show you a whole post-pathogen viral infection protocol. I'll open it up when we finish for questions. So if you have any questions, you can put them right in there. Dr. Sullivan and Julie will disperse them to me, and we'll have some fun. And, you know, utilize us because we're here now, and we're happy to answer any of your questions. The thymus gland. The thymus gland, photobiomodulation, or what I like to call the laser, I'd like to make this point right here and now, electromagnetic transfer of energy, may reverse or prevent thymic involution due to its ability to induce extrapenial melatonin biosynthesis via cyclic AMP or NF-kB activation, or alternatively by stimulating bone marrow stem cells that can regenerate the thymus. Remember, the thymus, primary site of T cell production, and is a key organ of the immune system. Deterioration of the thymus gland can lead to autoimmunity. So let's look through some of the ideas. We talked about the violet light. So the violet light is a 405 nanometer light. It's used in this study in 2014 for the inactivation of pathogens. It has a potential role for the environment disinfection and an infection control. So the conclusion to the study was as follows. Violet light, particularly the 405 nanometer light, allows for a significant antimicrobial properties against a wide range of both bacteria and fungal pathogens. The trial results reveal that the 405 light system can provide continuous disinfection of air and exposed surfaces in occupied areas of the hospital, substantially enhancing cleaning and infection control procedures. So here's a proof of concept in the viral inactivation. Let's look at the efficacy that it has with the virus. Here's a different study back in 2017, and that's just me doing a vagus nerve upregulation stimulation. Conclusion was as follows. The results provide first proof of concept demonstrating that antimicrobial efficacy of 405 nanometer light can be extended to medically important viruses. Well, what organisms are most susceptible to the violet light? People always ask, well, does it kill the good and the bad? Well, here we go. Both gram-positive and negative bacteria. Microbacteria, a single bacteria. Mold, yeast, and fungus. So early application of LLT, low-level laser, may reduce the incidence of PHN. So the conclusion in this 2016 study was very simple in that applying low-level laser within the first 5 days of the herpes zoster eruption significantly reduced the incidence of PHN. Again, light antimicrobial effects. The biggest advantage to using light alone to kill resistant microbes. The light is not as harmful to the host or the surrounding compared to the UV light and no dye required. EVRL is in the effective range. I said it pretty quick. I did not mean to skip over it. What I wanted to say, and hopefully this will resonate with everyone very simply, is the advantage is the light alone kills the resistant microbes. It's not harmful to the host. So when we're lasering, one of the beautiful parts about the Aconia laser, the EVRL, the 635, the Accelerate, and the like, is there's no downtime. There's no side effects. It's what we call here a class 2. There's no heat production. It's electromagnetic transfer of energy. The body absorbs it, and then it stimulates its own natural pathways. So if you're a chiropractor, naturopath, alternative practitioner, every one of them, us, if you will, is looking to stimulate the body's innate systems to fix itself. If you're more of a medical provider, the same thing holds true. Everybody I spoke, they all would prefer not to have you something to stop a system or a pathway from working. They would like to be able to regulate like a volume of the system and the pathways versus a push button. The laser allows you to do it in a way that's based on science. Again, electromagnetic transfer of energy. Photons go in the area of the body, absorbs them, stimulates cellular reproduction, ATP oxygenation, neurotransmission. Lasers are great, not just for helping the body systems, they're good for prehab, they're good for injuries. Once again, I use them in a light of applying them to the brain. And here's another study that speaks to the idea of antibacterial, antifungal effects of the 405 nanometer light. So irradiation with a 405 nanometer light has significant bactericidal, fungicidal effect. P. gingivitis, if exposed to 5 minutes on the violet light, had a 60% inhibition rate. P. intima, if exposed to the light for 5 minutes, had an 80% inhibition rate. C. albicans, if exposed to light for 10 minutes, had a 90% inhibition rate. So the takeaway here was the 405 nanometer irradiation was a great strategy for the prevention and treatment of endodontic infections. So yeah, use it in your mouth. So I alluded to a little bit, and I hope I'm not jumping too much about the gut to brain axis. We're now finding that there is, believe it or not, a nose microbiome, a nasal microbiome axis to the brain. So here's an upper body virus protocol to help prevent viruses or the transmission of virus and bacteria in your office.
Hey everybody, it's Dr. Tom. I'd like to show you the upper body virus
protocol. You're going to find this very helpful in your practice, and obviously it's going to be very popular. As you can see, I'm in my gym downstairs. I'm home. My wife, please come in. She's going to play the patient, so that's why we're not wearing any gloves or anything like that. So we've taken all the needed precautions, and I just want to show you some of the things that I would do for the upper body virus protocol. So I'm going to go for the inner ear, down through the maxilla towards the mouth. Now, I'm only going to use the violet light to show you there. And I'm going to use the violet light. You could use the violet and red. I don't have a problem with both. So I'm going to do the right side. Now I'm going to go over to the left side. Obviously, this is not a full treatment. This is for demo purposes. While I'm here, I'm going to go right to the nose portion. There's a tremendous amount of viruses and bacteria that live on the outside of the nose. I'm going to ask you to open your mouth, go for the hard palate, get inside the tongue, kill any viruses and fungus, any bacteria in there. Then I'm going to come up to the forehead. If she has any sinuses or anything, I'm going to try and help her out. I go right for the apex of the lung. So here's that apex of the lung right here on one side, apex on the other, and then I'm going to come right in here, cervical neck region, if you will. One of the little extras that I try and give my patients, obviously, again, we don't have to wear gloves, is I'm going to laser her hands. She can transfer to her face, transfer to her hair, transfer to me. Someone could rub against my chest inadvertently, and I don't want to be a carrier, so we'll do both hands. So one of the things that I would strongly recommend is the EVRL. And the EVRL is very handy because it really, with the two lights, the 405 and 635, give a synergistic outcome. I was using 405 for demonstration purposes because it's handy. So that covers the upper body virus protocol. Let's now go to what I call the gut to lung access protocol. For me, this is something that I believe is very revolutionary. The gut to lung, it was just put in my book, which is coming out in a few months, because it's so, for me, important. And hopefully in this video, you'll see a couple of the salient points that I'd like to share. Hi, it's the demo time. I'm now going to demo the gut, how to keep good gut health, how to keep a good gut to lung axis, which is really a breakthrough in a lot of the conversation pieces in laser therapy and functional nutrition, and gut's impact also on, as we talked about, hypertension. So we're going to have somebody come here. Your patient's going to lie supine, face up. We're going to start with the EVRL, and we're going to start with just the violet light. So I'm going to turn it on, and you can see it's on. It cascades, it illuminates on my shirt. Her shirt won't illuminate as much, it's just color doesn't reverberate back. So all I'm doing is using the violet light. I am using the violet light in her abdomen, gut area, making emphasis on the right side, because on the right side, we've got the small and the large intestines where we want to kill bacteria, fungi, and of course, we're doing antiviruses. There are viruses in this area, sorry about that. So we're going to do sweep the area. And I would spend more time here than I am now. This is for demo purposes. While we have her in a supine position, I'm going to go to the upper lung, and I'm going to get the lung area to the lung, because as we know, in COVID-19, it's the upper respiratory area. In addition to that, I really want to make a point. I do believe that we've overlooked the gut. It's 80% of our immune cells. It's where macro and micronutrients are absorbed. And I don't think we've talked about it enough in COVID-19. I think it's been an oversight. So I would definitely do all my protocols that we talked about and incorporate the gut. Now, also, if you just have the EVRL, one last thing with it, we'll go to user, and I'm going to turn on both the red and the violet, and then I would sweep the gut again with both the red and the violet. The red is going to be very helpful at 635 nanometers because it's going to help with the interleukins and help with any kind of epithelial wound healing. So run it there. And if you have the Pierre resistance, if you have the FX635, I would bring it in here without question. And I would bring it in this area, get it right in the gut. Again, this is all demo purposes. That's why I have a lot of space. I'm putting it right here. I'm actually getting in the kidney area, close enough to the kidney. She's petite enough to do that. And I'm going to turn it on. And there you go. Now, lastly, if you have an FX635 and an EVRL, I'm going to go back in. I'm going to go to the acne setting. And at the same time with the acne setting, I'm now going to do the apex of lung, gut lung. One more time, obviously it's going to lose more time, and I would also hit the vital line where I have the FX635. So once again, the gut acts the gut to lung, and when you positively affect the gut, you're also positively going to affect your hypertension. That's been proven. And I also got the kidneys because she's fatigued. And with these pretty staunchly long, powerful arms, you're able to get the kidneys also. So again, I do a lot of functional medicine. I haven't found anything that goes in conjunction with the nutritional protocol for the gut like the FX635. So that's gut to lung axis protocol. Let's go into the vagus nerve a little bit and why, and we're definitely going to demo that. I'm sure everybody's going to ask some questions. Stimulating the vagus nerve actually releases acetylcholine, which is a neurotransmitter, which is a chemical released by a nerve cell or a neuron. It causes the muscles to contract, activates pain responses, and regulates endocrine and REM sleep functions. It reduces inflammation. It improves outcome in rheumatoid arthritis and also has shown to inhibit cytokine production. Vagus nerve has a positive effect on gut health. It's shown because it inhibits the upregulation of NF-kB. It has a very positive, robust effect on intestinal tight junction health that typically gets compromised from the release of lipopolysaccharide and endotoxin inside the gut. Ultimately, it decreases or attenuates the disruption of intestinal tight junctions. Vagus nerve stimulation, which I'm going to show you, shows promising results in treating chronic inflammatory disorders. Please make note, any kind of lung injury, autoimmunity, blood sugar, and helps to control pain for those that have fibromyalgia and migraines. It is a very versatile type of laser. So here's interesting in that you're really speaking about the idea of the celiac vagus nerve. That portion shown that to stimulate that celiac vagus nerve actually primes an immune response in the spleen. So the vagus nerve has branches. It's not just from the medulla oblongata down through the transverse colon. It's got a myriad of branches that affect everything in between the spleen, the heart, the lung, the kidney, well, not the kidney, excuse me, the stomach region and in the intestines, everything between the medulla oblongata and the transverse colon. So vagus nerve stimulation, let's really take it to the next step on the gut to lung axis. That stimulation is an effective strategy to protect against acute lung injury. Protective effects of the vagus nerve stimulation to prevent acute lung injury. Very interesting, very well-known hospital down in New York City. They now have vagal nerve specialists, MD, PhDs that are talking about putting in stimulators. In my office, I found that we've been able to more than adequately, and I am really underselling when I use the word adequately, the idea of stimulating the vagus nerve because of all the positives that can come with it. And I've done so through tests of the heart rate variability type. Pulmonary epithelial permeability, there's a leaky lung. Gut to lung axis, you have a leaky gut, you've got a leaky brain. We also have leaky guts. Healthy barrier systems, the gut, the blood-brain barrier, the nose and upper respiratory, lungs and skin. So lungs, they also have tight junctions. Claudin proteins keep the pulmonary barrier intact. Claudin is sensitive to chemical irritants or pro-oxidants. Chronic inflammation will break down these barriers. The key to most tight junction help and structures in the tight junction is the utilization and or the creation of L-glutathione, the master antioxidant, because it's critical to protect against lung damage. Let's get into the idea of what low-level laser does for this cytokine system. especially with one in this study with chronic viral hepatitis. Measurement of blood cytokine levels in those treated with low-level laser revealed decreases in 1 interleukin beta, interleukin 6, TNF alpha, and a rise in pro-inflammatory interleukin 4. So for the most part, it really was decreasing all inflammatory markers. The conclusion, the use of low-level laser has a marked beneficial effect on the cytokine system on patients with chronic viral hepatitis. Low-level laser improves the functional activity of the vascular endothelium and is a nitric oxide producing capacity. Anti-inflammatory effects of 635 nanometer irradiation. Conclusion, not only direct exposure with 635 nanometer light, but also indirect exposure can inhibit activation of pro-inflammatory mediators and may be clinically useful as an anti-inflammatory tool. Check out the mediators tested for the anti-inflammation. 2 inflammatory pathways, COX-2 and PGE2. The attenuation of the inflammatory response and polarization of macrophages by photobiomodulation, another word that's synonymous with low-level laser or non-thermal laser. They evaluated the anti-inflammatory effects of photobiomodulation, which suppress the expression of classically activated macrophages, inducible NO synthesis, mRNA expression, secretion of pro-inflammatory cytokines, TF-alpha, interleukin-1 beta, and NF-kB, all showing, as of last year, a tremendous decrease in inflammation expression once tested after application of low-level laser. The modulation of lipopolysaccharide-induced NF-kB signaling pathway. So LPS stimulates the NLRP3 inflammasome. We talked about that before. Lipopolysaccharide endotoxemia actually stimulates the release of NF-kB, and it's shown to show a decrease in that NF-kB release, COX-2, ROS, etc. So the mechanism by which 635 nanometer modulates LPS-induced NF-kB signaling pathway was shown by the HSP27 inflammation. The bottom line, the takeaway here is you can put the 635 red light on somebody's gut. And what I found in my office, I have found tremendous healing, so much so that these inflammatory markers will not be stimulated, definitely helping with the immune system as far as I'm concerned. Photobiomodulation of the microbiome. So we talked about the implication for metabolic and inflammatory diseases. There's a tremendous difference in diversity between those who were lasered and those who were not. In mice, believe it or not, the favorable improvement in good bacteria was 400-fold. Using this as an adjunct in treatment in everyday life of obesity, lifestyle-related disorders, cardiovascular, and neurodegenerative disease. So lasering for gut health. My take. Non-thermal laser helps conditions such as IBS, Crohn's disease, ulcerative colitis, and leaky gut. My reasoning, the laser saturates the area with oxygen, which makes the environment less hospitable for bacteria. Laser therapy also decreases intestinal inflammation. So I'm just going to get somebody in here right now. I am going to talk about the post-viral, perfect timing. One of my staff members just walked in. So I can't see my, can you guys just confirm that you can see the screen? Because I can't see it.
Yeah, I can see you.
Yeah.
Okay, great. I don't want to get too close, guys. So how are we doing? Everybody happy? Everything's going well? Let's go see if we had any questions in here, anything like that. Nope, not yet. All right, so there'll be a whole bunch of, oops, sorry about that, everybody. All right, let's go to the idea of post-viral or bacterial demo. My goal is to attenuate, decrease the release of cytokines at multiple levels, enhance recovery. So I'm going to bring Vanessa. I'm not wearing a mask because I tested positive. It's okay. Come on in. And, you know, we adhere to all the social distance.
Negative.
Oh, that's right, I'm negative. Thank you. Been a long day already, guys. Been a long day. Woo. Anyway, so come on in here. So there's going to be 12 touch points. Again, for whatever reason, my camera's not, there's no way we can get I got it on. I can't see the camera, so it's right over here, but they said that it's on. Not a problem. Well, I'll figure it out. If you guys can't see me, somebody speak. So there's going to be 12 touch points that I'm going to recommend. Now, just so you know, I'm going to use the EVRL. Let me get nice and close. And I'm going to press play. If you have any questions on it, I better do it here. There's the red and the violet together. I am going to use the red and violet together. This is very unique to the EVRL. So my touch points are going to be the nose, and we're going to do the nose. You know, we're not going to go intranostril, but we'll do the outside of the nose. We're then also going to do subcutaneous in the tonsils. We're going to do the trachea. We're going to do 1, 2, 3, the apical, the middle, and the bottom portion of the lung. And other than the trachea, we're also going to do the bronchia. So 1, 2, 3, 4, 7, 10, trachea, bronchia, before the vagus nerve, which I'll show you. I just can't get the camera. It's on, but I can't see the camera. So if you can do that, that would be great.
Looks fine to me.
Yeah, we just can't see it because I want to make sure that can run up and down. So we didn't get the CEO, the wife, but we got close. We got our assistant. You know what? Don't sweat it. Everybody can see me. We'll just do, we'll do it, and if she can figure it out, great. So face the camera. So I'm going to turn it on and go right in nostril 1. Now everybody's going to ask me, how long, Rob, are you going to keep it? 30 seconds, 30 seconds, 30 seconds tonsil, 30-second tonsil. Every other spot under this, 1 minute. If someone's had a bad viral infection, a bad bacterial infection, they're really going to benefit. 30, 30, 30, 30. 1 minute in the trachea, 1 minute in the bronchi, 1 minute in the apical part, 1 minute in the mid, 1 minute in the lower, both sides, and, you don't mind, the posterior. So you're looking at a relatively lengthy protocol. However, the results with this, if someone comes in with post-virus, have been stellar and fabulous. Do we have any questions on that? Because I don't see that. I'm a little surprised. So again, 30 seconds, 30 seconds, 1 minute left and right, and anterior, I'm sorry, and posterior. No questions. We're good with that. All right, so let me do the vagus nerve then. Now, the vagus nerve is going to be approached a little differently. So in the vagus nerve, I am going to go back 1. I'm going to go to my mode select. And I'm going to go to the acne setting. For me in the vagus nerve, in this area, I never use just the red light. It's just not what I do. I happen to use the violet light. There are some qualified practitioners that use the violet and the red in here. So be it. I found for me, it's effective enough to use the violet light. Why the violet light and not the red light? Everybody always asks me that question. I know it's a rhetorical question. I'm going to answer it. In that, I have found that the violet light was more effective. Believe it or not, the violet light, the lower the wavelength, 635, very positive, popular 635, a good amount of electromagnetic transfer. The violet light, lower wavelength, more electromagnetic transfer, good enough. Some people may need both, but I'm going to show you a couple of tricks of the trade, if you will. So I turn it on and it's just a violet. As you can see, the violet's here. It's going to look differently. She has a darker wear on, so it doesn't always reflect. So medulla oblongata, thank you, down through the transverse colon. You're going to sweep 3 to 5 times on one side. Remember when we say vagus nerve, it's really bilateral. There's 2 vagus nerves. There's both one on the right and one on the left. Interestingly enough, the one on the right speaks to the idea of mood and behavior. The one on the left speaks to the idea of stimulation of satiety. So we take care of that. And then I would go over here, switch hands. I try not to reach across the patient. And I would do the same thing in this area. My phone is moving, so I think we're getting some requests. Just give me a second. Oh. Okay, I thought it was an extra question. Sorry about that. So left and right side vagus nerve. Now, most interesting, we're going to go back. I want everybody to see. I'm going to stop. I'm going to go back a step. I'm going to go back to mode selection. I'm going to use user protocol. I'm just on test. I'm only going to do 1 minute. And now I'm going to come in the area of the ileocecal valve, which is in the right lower quadrant. The ileocecal valve is a critical element. It's also communicating, and the MMC, the migrating motor complex, both of them are communicating, or the vagus nerve has communication. So I'll spend a minute with both the red and the violet. Lastly, I want to get the auricular portion. Now, the auricular portion has a tremendous amount of impact on autism and other areas. The auricular portion of the vagus nerve. In that, I'm just going to go red and violet, as you can see right here. And I'm going to go for 1 to 2 minutes in each of the ears. And that's vagus nerve. Here's a good question. Great. Question from the candidate. It's so cute. The words are great. How deep does the violet light go? And already asking if that's deep enough for 30 seconds. Really good question. So I'm going to sit. You don't mind hanging out, yep. Right? Yeah. So that's a really good question. My understanding of the laser, and let's go through this and let me share. Let me see if I can make this connection with you. The absorption is 5 centimeters, but it's all about absorption. It's not about power and penetration. So it's absorbed for about 5 centimeters, and it's 30 to 60 seconds per side. It is enough. Get some heart rate variability. What a great tool in your office. What a great tool in your office to get the heart rate variability. Do a heart rate variability, and then laser with the vagus nerve to change the tone. That heart rate variability will increase prodigiously. You will be quite happy with your outcome. So it does go, it penetrates well. The violet light is the gem to the EVRL, and that's a critical element. Because of the versatility and increased electromagnetic transfer, you're going to be able to get better clinical outcomes. The other question, how will the PL Touch laser differ in effectiveness on post-viral treatment? I personally think that the PL Touch is a great choice for post-viral treatment. I happen to find that for post-viral, if you have a PL Touch, no one's saying not to use it, but the EVRL is a better choice because of the violet. The violet adds the properties of antimicrobial, antibacterial, antifungal, antiviral, antipathogen. It also adds extra electromagnetic transfer. And in addition, it has that synergy of the balance of the autonomic nervous system. So if you have a PL Touch, don't put it in a garbage bag or anything like that. But the EVRL is a more interesting choice. And if somebody after these would like, I can briefly, we have a few minutes left, I can show you the FX635. Okay, question. Can you treat a cardiac virus? How and where? From one of our end users. Okay. I have to be cautious. So where I practice, cardiac conditions get into what we call the gray area. However, from colleagues with medical degrees here, they have used the laser for specific cardioviruses or and have gotten very favorable outcomes? Fabulous question. You're going to get the versatility and the effectiveness when you utilize the lasers. Do you have any other questions? Would anybody like to see a quick demo on the 635? You know what? Let's do it, Vanessa. What the heck, right? Let's go. But we'll go into the traction room. Oh, you got it?
Mm-hmm.
Let's go. Let's go for a walk. Woo! Okay. What, Stephanie?
You can hold the things.
Okay. Okay. Poco bajo. So here's the FX635. Let me move this that way. So typical, we're going right face down. You saw patients face down. Look at the versatility of the FX635. Come right over here. And we'll do it a little longer. I'm going to come here and move it. And press the button and go. So now we're doing lower back. Now we didn't just musculoskeletal lower back. You can see it's on my traction table. I can drop the traction. If you're a manual therapist, I can adjust her. I'm not adjusting her right now, so don't think I'm doing one of the fake jobs or anything like that. But you can do that. Now, I'm going to get the bottom of her lungs because I was just informed of a question. Oh, yeah. In order to clear the lungs for COVID-19 and also make the immune system stronger before and after treatment. I'm not sure.
Before and after.
In order to clear the lungs for COVID-19 and make the immune system stronger before and after treatment. I'm not sure what they meant, but yeah, what I'll do is, here's your lungs. We'll not just say COVID. We don't want to always say COVID. We'll just say viral infection or respiratory infection with a virus. So we can go in here with the FX635. And here we go. So you can apply it right to the area. Before, in the videos, you had seen me with Mei. She was face down. She had done some work. I did some work on her face down. Could you hand me the EVRL in the other room? Do you mind? So I'm going to also get the EVRL. I'm going to show you a combination move. So Bonnie, would you boca arriba? So here's a great move. So now you're, thank you. So now you're lasering the stomach. So you're doing your stomach, great. You're also helping if they have a leaky gut. Most people that have viral infections will have a gut problem because, as we all said, 80% of immune cells are in your gut. It's where macro and micronutrients are absorbed. It makes a lot of sense because anything passing your body, it's your first line of defense, your skin, your digestive agents, and your microbiota, or critical elements in killing things. And of course, it goes through the whole process here. Now you can do a combination treatment. I'm going to again turn on the acne setting. So she has her gut getting lasered at this point. I'm also going to simultaneously do the vagus nerve. So you can just see it's on just on the color of her shirt and attire. It's not going to show as much. And I'm sweeping briskly for demonstration's sake. Any other questions? Or are we good? Great. Any questions on that? I'm looking at my phone. I'm just looking to see if there's some questions. And then, as I do what I would like to refer to as the PR resistance, go back in, go to where it's already set, and I'll do violet and red at the same time with this, and you get a combination treatment to help with the gut. Now, also, while you're here, and she's getting her gut lasered. If you have the opportunity to have 2 lasers, you then can do the protocol that I mentioned before. You can do in the nose, the tonsils, the trachea, the bronchi, apex, middle, lower lung, lower lung, middle, apex, and work this way. If you wanted to, then you could flip her and do the posterior. So you have the opportunity while she's under the FX635 to also apply the combined treatment. This is very potent. Patients wait online for these treatments. Once again, these are very potent. It's all based on science. So I'm going to shut the laser off. I'll go back in the room. We've got about 5 minutes, so if anybody has any questions,
Thank you.
and we're good. Let's go in here. Julie, Rob, do you have any questions for me?
Nothing at the moment.
Jules, did we get
Yeah,
anything?
nothing else. I'm just keeping my eye out, but there isn't anything at the moment.
Terrific. They asked a lot of great questions. They got a lot of information. I'll try not to shake. I apologize. My team here is saying that I'm shaking the table a little bit. I will share any and all the slides. And if they don't have any questions on the demo, let's just wrap it all up in a nice tight bow. It looks like I still have the webcam off now. So let's take the next 5 minutes and talk about how you control the host. You want to avoid certain foods, GPS and DNA. GPS, no gluten, no processed food, no sugar. DNA, no dairy, no nicotine, no artificial sweeteners. Always follow an anti-inflammatory diet. Try and control your glycemic load. Detect or avoid specific food sensitivities. I cannot emphasize enough how important it is to avoid food sensitivities. And of course, your environmental overload, your toxin overload. We live in a toxic world. These toxins are extremely ruinous to your overall health because toxins overwork the liver. There's a direct tie between the liver and the gut. They can damage the gut. So therefore, you want to decrease your environmental overload. Also, make clean eating a priority for life. Organic, wild smash fish, salmon, mackerel, anchovy, sardines, herring, plant-based diets, fruits and vegetables, grass-fed meats, high fiber, nuts and seeds, chicken soup. Good snacks would include organic dark chocolate, herbs, ginger, turmeric. Bone broth is great. My mom is homesick. She has a viral infection and we're using bone broth and she's responding quite nicely. Appropriate fluid intake, organic coffee and tea, oils like extra virgin olive oil, avocado, macadamia nut, all the different kinds of mushrooms, that whole composite of different mushrooms, shiitake, reishi, shanga, turkey tail, etc. Include nuts, avocado, olive oil in your diet. And let's get to some of these ideas of time restrictive eating. Time restrictive eating or intermittent fasting. Interesting that I'm a big proponent for time restrictive eating, intermittent fasting, to spread out your eating to a 8 to 10 hour window during the day. That 8 to 10 hour window will allow for autophagy and mitophagy, another topic for us to discuss in an upcoming webinar. That's really going to work synergistically with low-level laser. Get sufficient sleep, 7 to 8 good quality hours is what you would require to really revive yourself after a long, hard day. Good exercise program. Work with a practitioner online if you need it. Modify your stress. Do everything to support your immune system. And add the Aconia laser system to your everyday armamentarium. So essentially food. Why food? Well, food is medicine. Let medicine be your food. Immune system depends on adequate nutrients to function properly. As we're hitting the finish line, I want to leave a minute or two if there are any questions. Please keep an eye out. Been working feverishly in edits and re-edits, trying to get you the most up-to-date, accurate, flowing information. The name of the book is The Superhighway to Health, 7 Steps to Optimizing the Gut-Brain Connection. Sir Oliver Wendell Holmes once said, "The mind once stretched by a new idea never returns to its original dimensions." So before we open it up for questions, we have about 90 seconds. Anybody who needs to get in touch with me, please follow me on Facebook. We post every day. We do several videos a week. There's Facebook, there's Instagram, there's LinkedIn, there's my website if you need me. I have a Facebook group, mastermind laser group. Please join. We're doing videos. I'm answering questions. It's nice to be part of the group, the cadre, if you will. Would love to hear from you. And I'll turn it over to our hosts, Rob and Julie.
Thanks, Rob. Again, excellent presentation. Lots of stuff to think about. I don't think I see any more questions coming in at the moment. So you haven't got any, Julie?
Yes, there's nothing else coming through.
Okay, so what I'm going to do is just wrap it up. Thank you, Julie. Thank you, Rob. Anyone that has any questions, if you just email them in to us at Aconia, you can email me, rsullivan@aconiaeurope.com, and I'll get them to Rob and he will get them back to you. So thanks everybody for your time. I know it's relatively early where you are, Rob, well into the evening now where Dubai is, where Julie is. And here in Dubai, it's well past midnight. So I'd like to say good morning, good afternoon, and good night.
Thanks, guys.